Namaskar. Myself, Professor Dr.Madhav Diggavi. मैं एक आयुर्वेदिक वैद्य. I am practicing Ayurveda since 3 decades. I am professor and HOD in the Department of PG Studies in Kaya Chikitsa and Andrology. I did my post-graduation from Gujarat Ayurveda University in 1998. I started my career in PG studies with male infertility. From 1995 onwards, I have started practicing on male infertility. Until now, the same practice is continued. And we practice only Ayurveda, and we do evidence-based Ayurveda practice. We are practicing scientific Ayurveda, and we are using all modern technology in understanding the infertility, and Ayurvedic solutions are given. As per ancient Ayurvedic techniques, ancient Ayurvedic methods, and as per classical textbooks of Ayurveda, we are adopting the treatment programs. And we are doing individualized services, personalized solutions. Today, I am going to talk on male infertility. Friends, infertility is one common word nowadays in the market, in the media, in the social media, in the print media. Infertility is a big terminology where patients or couples, they suffer with this term. So let us understand what is infertility. If you want to know infertility, the word has got in and fertility. There are two terms in that. Fertility means a person who get married. In Indian scenario, the person who get married, the couple will be dreaming of a blossom, that is a child. After marriage, everyone will be dreaming of getting conceived, getting pregnant in the wife, and then getting an offspring or a child. If this dream doesn't come true, then the married couple will be in trouble. Then fertility is not there, so they go to the doctor, they go to the gynecologist, they go to the andrologist, they go to the fertility centers in the market, and they start undergoing investigations. So if you go to the the media, social media also tells about what is infertility. Infertility is a term, it is a medical term used to denote there is no reproductivity in that person or in that couple. So the person who is trying for since last 1 year, in the period of 1 year, they are trying unprotected sex without any barriers, without any condoms. If they are trying for reproduction, if the male is normal, female is normal, they should get conceived within a period of 3 or 6 months in a normal course. But even after 1 year, if they are unable to get pregnant, then that condition is called infertility. So infertility can happen to both people. See, when two hands join together, there is a collapse. In the same way, male factor and female factor. There are two types of infertility. One is called male infertility, where male patient is having a problem. Another is called female infertility, where female spouse is having problem. So the doctor, whoever goes, they will investigate both male patient as well as female patient. Then they come to some conclusion that what is the problem with male patient, what is the problem with female patient. Based on that, solution patterns, solution protocols, international guidelines and infertility guidelines start working. So the first step in infertility is the patient should understand what is their problem. If couple are having some tests positive, some structural abnormalities there, in only male problems are there, or in only female are there, or in both of them there is some problem. We have to understand this carefully. There is a taboo in India till today that if the couple is not pregnant, the in-laws or the friends and relatives will ask only the female patient. They will never pressurize the male patient. Actually, the male and female both should come to the doctor, both should come to the fertility clinics, both should come to the reproductive centers and undergo series of examination. Firstly, the doctors or vaidyas will ask some questions related to some sexual performance, related to the menstruation, related to the semen discharge. They will ask some basic questions. There is a period called fertility period is there. So the fertility time is in a lunar circle of a female's menstruation. After the menstrual cycle is over, once the menstrual bleeding stops, there is a development of issues related to releasing of the egg, releasing of the ovum. So when eggs are released from the ovary, from the female every month, from one side, left side or right side, there will be releasing of the egg, ovum. If that is normal, for that there are some tests, and it will be even recognized by basal body temperature chart. Then female will be routinely taken into the investigation. In the same way, male patient also is taken to the investigation, and we will try to work out my male patients the sexual performance parameters and male patients semen parameters. Semen is that fluid ejaculated during the orgasm. When male and female patients do the copulation, do the sexual act, the discharge from the male penis is called semen. And there is quality and quantitative tests for semen. When we check both of them, and both the parameters, the ultrasound scanning of egg releasing pattern, we call it as follicular study, follicular scanning. It is done on 9th day, 11th day, 13th day, 15th day, so on. Whether egg is properly released or not, we will check. Whether fallopian tubes are patent or not, whether uterus is healthy or not. Endometrium, the inside membrane of the uterus is called endometrium, that can be checked. A tri-layered pattern of the endometrium we will check. Like this, in general, female is tested, male patient is also tested. Then hormone levels of the male, hormone levels of the female are checked. Female patient is dominant with FSH, LH, prolactin and estradiol, whereas male patient is checked for FSH and then testosterone and prolactin. New hormone study we are doing, one is called AMH, anti-Mullerian hormone. In both male and female, this will be checked. That will tell about the fertile rate. If AMH is normal or optimum, female will have egg releasing and egg quality very well. In the same way, AMH is normal means spermatogenesis and sperm production in the male is normal. So like this, in the modern investigations, modern laboratory tests or patient examination, gonadal examination, scrotal size, testicular size in the male, penile size in the male. In the same way, uterus, fornices, cervix are all checked in doctor's examination report. Once that report comes, then they will decide, doctor will plan what can be done. Whether any simple medicine will help, simple diet modification will help, fertility chart will be helping. Like this, nutritional status, if the patient male or female are having hemoglobin is less, nutritional values are less, low nutrition is there, then also they will have a problem. If there is no problem in the body organs, sometimes the psychological component of the male and female patients are having. Nowadays we see that so many people are upset with stress, there is a conflict. There are some personal relationship disorders, behavioral changes, all these things will be counted. So beyond everything, a healthy male patient, healthy female patient, physically, mentally, spiritually, biologically, if the couple are healthy, then there is a chance of fertility. If the couple are not healthy, then the chances of fertilization goes down. For that, the doctor or fertility experts, Ayurvedic Vaidyas will make their own approaches, their own plans, and based on that, the treatment is planned. So to conclude today's first talk on infertility series, we have understood today what is infertility, what is fertility, Infertility means a capacity not to conceive or not to get pregnant in the spouse even after 1 year of trial is infertility. Then 50% is contributed by male patient, 50% is contributed by female patient. So both male and female patient should come to the fertility clinic and get checked. And Ayurveda has got a special branch called Rasayana and Vajikarana branch. This Rasayana Chikitsa and Vajikarana Chikitsa branch itself is dedicated for sexual, reproductive and andrological problems, and also eugenics problem. Eugenics is a divine concept in reproductive medicine, that if one baby is born, that should be strong physically, mentally, genetically, personality wise, everything. It should be totally good product. So for that we call, even one baby is born, that should be sustainable and strong progeny, that should be helping to the contribution of nation's growth and development. In all way it should be positive. Like this, Vajikarana is one of the special branch of Ayurveda, where it will treat either semen problems or women problems, or both together. And Panchakarma is one more branch of Ayurveda which helps in detoxification, purification and maintaining the good value of the tissues of the body. And holistically, Panchakarma, Rasayana and Vajikarana Chikitsa and the branch of andrology, reproductive biology and eugenics will help the patients who are suffering with infertility. I am in this field since 3 decades, since my postgraduate research, and we are getting different number of patients, male factor patients, female factor patients, and we are going to give solution in our specialized andrology setup and specialized reproductive medicine programs, where many of the postgraduate scholars, internees and students of Ayurveda and modern medicine posted house surgeons are all exposed to understand this special branch. It is not a mainstream branch of emergency care or main surgical care or national health issue care, but one who suffers with infertility, they only know the issue, they only know the sadness of that issue. One who don't get children, they feel their life is nothing. So such a huge impact is there in the market. They are mentally and spiritually, and they get very low esteem in their life. They don't come out of their home and talk to others because they don't have children. They may suffer with a simple problem which is like cough, cold, fever, joint pain. Infertility is also same medical disease. Any male or any female can disease. There should not be any taboo. The people should come to the Vaidya or doctor and discuss with them, make a plan, undergo some investigations. Evidence-based problems are decided, and based on that we can give solution. And the solution is of 3 types. Number 1, maintenance of the good positive health. Number 2, good nutritional values to the both male and female. Number 3, mental, spiritual and human values are to be good. And lastly is reproductive organ disorders. Like this, we will treat the patients who come to our andrology department, and we go through detailed formats are there. Accordingly we test and then we make a plan. So public should realize that infertility is not a curse. Infertility is a common disease like any cough, cold, fever. Discuss with your specialist in the field, and then you can get evidence-based, special, personalized, tailor-made solutions to your problem. Infertility means don't get low esteemed, don't get depressed, don't get suffered in your mind. Come out, speak out, talk about your problems in front of the doctor, and the doctor can give you best solution. Dear friends and my citizens, in the coming issue, in the next series, we will talk on what are the causes for infertility, why people get infertility problem. We will talk about that in next series. Until then, take care of you. Namaste.